Going live. I like that. Good afternoon, everyone. Thank you so much for joining into our ICHRA Awareness Series. I'm Deb Wilkinson. I'm the Senior Vice President for URL Insurance Group. My focus is very specifically right now on ICHRA. And the reason for that is that stats show that 42% of mid to large groups are going to be exploring and talking to somebody about ICHRA. So my question to you is that going to be you, broker partners? I hope it will be. You certainly have a lot of resources within URL to assist you. Our URL ICHRA email is pretty easy. It's ICHRA, ICHRA, at urlinsgroup.com. Also in the QSARA market, QSARA is the Qualified Small Employer Health Reimbursement Arrangement. The QSARA does tie into Penny. So most of you know that the 2025 Penny certification has come out. It's brand new this year. If you've not done that and you are exploring these markets, I encourage you to, one, do your Penny certification, and two, reach out to me or to the URL team to get appointed with the carriers that you will be selling on Penny. The rates actually were just approved. They're posted on the Pennsylvania Insurance Department site as we speak. Pretty interesting and pretty modest for most carriers in our area. So that's really encouraging. But today we're here for one specific reason. And, you know, I've said through this entire series, and this is actually the last of our series within our series. But I've said that, you know, the opportunity is there. You just have to really educate yourself. But again, there are people here at URL on our ICHRA team that can lead you along, help you with the quotes and help you with the affordability testing and really the strategy, whether it be small group with QSARA, ICHRA, or even looking at dissolving that group and just going straight to Penny. There are a lot of opportunities for all of us. Within the ICHRA platform, again, at URL, you have such great resources that can, you know, again, compare those group health plans and really come up with those great comparisons for you to take back to your employer groups and give them the best options. Because again, if you are not talking about this with your current groups or even prospecting for new groups, you're missing the ball. You don't have to be the authority or the know-all. You just have to know who to call. And again, that is part of this webinar series. As always, they're recorded. They're on our website for you to use as a resource. For questions, you can put your questions in the chat box, and we'd be happy to answer those during and or after the webinar. And for now, I'm really happy to have TakeCommand Health with us here. I think TakeCommand was really, at least for me personally, one of the first ICHRA solutions that came out to the market, at least that was heavily advertised, that we first became aware of. And just as a reminder, these ICHRA solutions are really comparable to employer group Ben admin systems. They are an election and an enrollment and a payment authentication system. So it really creates that group health feel for the employees when they are transitioning from a more traditional group health plan. So again, I'm so thankful to have Charlotte Smith here. She is the Director of Partnerships with TakeCommand Health, and she's going to take it over and educate us all on their platform and what sets them apart from the other ICHRA solutions. So Charlotte, thanks so much for being here. Take it away.
Awesome. Thank you. And I'm going to pull up my screen here, and it always flips the way it's supposed to be because that's how technology works. But it's really a pleasure to be here with all of you. And thank you again, Deb, for setting it up. It was fun getting to know you a little bit before we started here. Move this over. Make sure I can see what we're looking at. Okay. Thank you for your time today, everybody. I know that you have a lot of options on what you can be doing with your time right now, whether you're live or watching this later. It's a really, really busy time of year. You're being mid-October almost. I know Take Command is feeling it both in our prep for open enrollment as well as finalizing some of those last minute clients that need to look at ICHRA for January 1st. So our sales team is also vigorously working to get those last minute groups in. So one pitch here on October 10th is if you have clients that you're thinking about ICHRA for January 1st, go ahead and send those over and let's analyze them, because there is some time limits we have to work within. As Deb mentioned, I'm Charlotte Smith. I lead our consultant relations team here at Take Command. I've been here almost a full year, which is scary to think about because it's gone by in the flash of an eye. But really, my main goal is to make a really good experience for our broker and benefit consulting partners. So whether that be getting a quote and analysis, whether that be on the backside with service, or even just making sure you're getting your commission statements, having one central person to make sure that all things brokers, producers, benefits consultants are taken care of. So my goal today is to walk you through ICHRA 101, but then how does Take Command fit in? We did not invent ICHRA. We've been around it since before it started, but how do we service our clients when they're moving into ICHRA? And then what do we think about for which clients are going to be a good fit, which ones aren't? Not every single client is going to be a good fit. So we want to make sure that we're talking about those right ones. And then how does Take Command work with you and your clients to implement and onboard into this crazy thing called ICHRA? Quick introduction to Take Command. We are the longest standing ICHRA vendor in the space. As Deb mentioned, we were founded as a company in 2014. ICHRA didn't become available till January of 2020. But we really did get involved in what this space was in 2017 when the QSARA regulations became available. And that is all we do today is QSARA and ICHRA. And we were there to help build the regulations that are in place today to be able to offer ICHRA to your clients. One thing that I always just put in a frame of reference, so this became available January of 2020. I had a child in January of 2020, and she is 4.5 years old. So a lot of the things that we talk about with ICHRA, it's a really good fit for a lot of clients, and we're seeing a lot of savings. But there are still some operational gaps and some things that feel a little off of the group health plan that we're all trying really hard to work and build upon so that this can be a viable solution for all of your clients some days, not just those that are backed into a corner because they got another really high renewal. That really is our goal, is how do we make the experience with ICHRA as equal to group as we can, and then eventually even better. We have over 6,000 clients all across the country. We work with brokerage firms all across the country. I think our count is more like 300 different firms that we have mutual clients with. And then we really do take on this thought leader aspect to our experience in the market, so much so that we are still very active members in the ICHRA Council, which our CEO and founder, Jack Hooper, helped found as well, kind of as an advocacy group for those entities across the country interested in enhancing the ICHRA experience. So the ICHRA Council is made up of benefits consulting firms, ICHRA vendors, insurance carriers. Really, they work on a lot of lobbying with policymakers, answer a lot of questions, come out with, some of you may have seen the yearly ICHRA Council report just about the market in general. So it's a really good place to get some data points as well around what ICHRA is doing and how it's growing. So what is ICHRA? If you have listened to other of these webinar series, probably every single vendor or carrier has a slightly different way to describe what it is. It's a very complicated and overly cumbersome regulations, to be very honest. That's our government, right? But what it is, as simply as possible, it stands for individual coverage, health reimbursement arrangement. But at its very basic, a lot of you that have clients that are employers, typically you and your client will get together on the group health plan model and say, okay, me, Bob's Burgers, and me, my broker, are going to go figure out how much it's going to cost me from these carriers to cover my group of employees. Hey, Blue Cross. Hey, local TPA. Hey, UHC. I have 56 people. I think we should do fully insured. What does that cost? So your client chooses a plan or a few plans. They take the price for, and they offer those plans to the employees. All the employees are happy. They're getting benefits through their employer, but it is a defined benefit. The employer is choosing what the employees are picking from. And that is what we're all really, 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 really used to in this market. What the ICHRA does is it flips it on its head. It allows your client and you to say, can't I just set aside a certain amount of money to give to my employees? And then they pick their own plan. The answer used to be no, but now with ICHRA, the answer is yes. It provides a tax-advantaged way for your clients to set aside an allowance for their employees to go purchase their own plan from the individual market. So it moves from group plan, which is defined benefit, to now an ICHRA model where it's defined contribution. Your client is saying, I have a certain budget that I need to stick to, and this is how I'm going to divide it amongst my employees in a compliant manner. Now my employees have the right to choose what they'd like as far as their insurance. So, of course, there's pros and cons in every arrangement. We're going to talk about the pros. What's in it for each of these entities? For your clients, savings and cost control is a huge piece of why we see employers wanting to come towards the ICHRA. In almost all analysis that we do, there is significant amount of savings for both the employer and the employee. Right off the bat, in many geographies across our country, the individual market is more affordable than the group health plan market. So just by switching from like plan to like plan, there's cost savings. And there's a whole lot more that we'll get into in a little bit. But this is really the biggest benefit for some of our employers is that cost control. Thinking about why some of these employers are having increased costs, they're getting another high renewal, is maybe because they have a few high cost claimants on their group health plan. Moving to ICHRA removes that risk of the high cost claimants. Now your clients can really care in their hearts about their employees, but not have to take on the financial risk of those high costs by moving them into the individual market where there is not medical underwriting. It's a big reason why there is so much cost savings and control within ICHRA. This last bullet here for employers, there is no participation requirements within ICHRA in the individual market. There are certain industries that really struggle with this, or they can't get a quote from certain carriers because of it, or they're getting really high pricing because they have a huge amount of eligible employees, but no one is taking the plan. That doesn't matter within the ICHRA. You can set up an ICHRA program for 1,000 eligible employees, and it's okay if only one takes it. There's no ramifications of that. On the employee side, it's all about choice. So now I get to decide, I, Charlotte, have these needs for myself and my family, and I'm going to choose the best plan that meets those needs. Whether we're very low utilizers of the healthcare system and think the cheapest premium is going to be good for us, or I know that I have children with special needs and we're at the doctor a lot and maybe we have surgeries coming up this year. And so I'm going to pick a plan that seems like it has richer benefits, but that was my choice on what to do with my employer's allowance, whether it covers my whole premium or whether I'm paying more out of pocket. It was my choice. So again, cost control on both employer and employee to decide to do what to do with their hard-earned dollars, right? So that is kind of why employers are coming to us and then what employees are experiencing on the pro side. I know many of you probably know the individual market really, really well. But a lot of the clients that are coming to us are much more attuned to the group health plan market. And so sometimes their first question is, well, I don't really know anything about the individual market. I remember back in, I don't know, 2012, 2013 timeframe when healthcare.gov launched, and it was kind of messy. That's all I remember. That is not the individual market of today, again, as many of you know. So when we are talking to employers about the look and feel of the individual market, this is some of the things that we're trying to help encourage them. They're going to see logos of carriers that they recognize in our portal. They're also going to see logos of companies that have really made their mark on the individual market, like Oscar and Ambetter. So there's going to be lots of choices. Everything that we're showing them is ACA compliant. The individual market is a really interesting place because there is no medical underwriting, meaning premiums only vary by age. We are able to set up reimbursements for employees that are 65 and older and helping move them to Medicare, but they're still eligible for reimbursement. But the plans have all of the same free preventative care, essential health benefits as you see on the group health plan side. There's almost 22 million people currently participating in the individual market, and we expect that to only grow. On average, we see about 88 plan options comprised of about 5 carriers in any given geography across the country. So there are lots of options. We'll talk about how we help sort through those options. But it is a strong and growing place to be. This map just shows how it has grown over the course of time. So just a little entry into what this map means. This is generated by IDEON, who does a lot of analysis about the individual market across the country. This map is from 2019, and everywhere where you see green, the individual market was less expensive than these small group health plans. Those are community rated, they're easier to track. I've seen some people try to put together large group health plans. It's easier to compare against small group in this manner for what we're talking about. Okay, so in 2019, of course, ICHRA was not available at that time. The regulations were being written, but they didn't go into place until January of 2020. So if we flip to 2024, you'll see a whole lot more green pop up on the map, right? And I'll just flip backwards once so you can see it again. So this is 2019, this is 2024. You see a lot of areas really start to light up as green, meaning again, the individual market is more affordable than the small group health plans. You can probably also tell there are certain areas of the country where vendors like myself have a lot of focus because it becomes a no-brainer to quote this for your clients in places like Georgia and Ohio. Pennsylvania is probably our largest book of business right now. Colorado, the state of Washington, Indiana, Minnesota. But there's also places that you're going to see, well, gosh, there's a lot of purple. Don't let that fool you. You should still look at it. The state of Texas, as an example, there's one county. That might be Houston. I'm not sure. There's one county in Texas that's green. Everything else is light to dark purple. Texas is one of our largest books of business. It might be because we're headquartered here. I don't know. But it's always worthwhile just to look and do a market check on if this might be good cost savings for your clients. Guess where we have a lot of clients also? California. So this map just shows there's some no-brainer places. But if your clients are experiencing some of the problems that I'm about to put up here, please get in touch with us and we'll help you think through it all and help you determine, is this going to be a fit or not a fit? So who is TakeCommand? What do we do? Why we do? So we are an ICHRA administrator. We help you and your clients from end to end manage an ICHRA program. How do we do it? We have a platform that was purpose-built to manage HRAs, QSERA and ICHRA specifically. There's a lot that this technology does that can help with the administration of, but really, if you want to know what we think is our differentiators in the market, it's the 3 pictures below. Number one, we've been doing this for a long time. We have a lot of experience and expertise in ICHRA in helping you build affordability, and is this compliant, and what about COBRA, and how does Medicare work? Our sales team are experts in building the analysis, helping to set expectations and educate on what this crazy thing we're all talking about is. Our senior account executives have been with TakeCommand on average of 4 or 5 years, which again, as you remember, ICHRA is only 4.5 years old. So they've been doing this for a very long time, and their expertise will absolutely help on the education piece of moving new clients in. ICHRA and the move to ICHRA is definitely a practice in change management. So we want to make sure that we are setting you and your clients up for success in this move. The second thing is in-house support. Everything TakeCommand does is by TakeCommand employees inside of our walls. I sit in our corporate office in Richardson, Texas, and so do about 95 of these 120 US-based team members. We have another office in Austin and a very few remote employees. But everything from the design process to the shopping and enrollment specialist process, to our client success, to who's submitting the applications for the individual market, to our payment functionality, to helping with coverage issues, sit within the walls of TakeCommand. Why does that matter? It matters for employee experience, so they don't have to bounce around from one place to another, and it's all taken care of in one place. Now, the downside for TakeCommand is if something goes wrong, we fix it, and we have to fix it, right? But the plus side for our clients and their employees is it's all in one place, and we're really proud of that. The last thing that's really important is employee advocacy. So if we were not the ones submitting applications, we do, just in difference to some of the other ICHRA vendors you might have heard from, we do retain agent of record on all of the individual policies. Now we'll talk about how we compensate our broker partners. But because we retain that agent of record and because we have all the in-house support, it really allows us to be close to the carriers, the applications, and any challenges that might come up with coverage or claims on the backside. We actually have a whole team that works on carrier relationships. They're our carrier account management team. I know that Deb knows them really well. And they are kind of our bat phone into the carriers and help if there seems to be a systemic problem with several of our enrollees. We know that we can pick up the phone and get to some of our carrier partners really quickly and resolve those challenges more quickly than we might be able to just with an individual policy that's a one person. So that employee advocacy within our TakeCommand Insurance Agency is really important. And we feel like it sets your clients and their employees up for the best experience possible. What is the platform? HRA Hub is our platform that helps both employees go through shopping and managing their allowances and plans, as well as your HR teams at your clients to administer their ICHRA program. So these are just some updates. HRA Hub is our second generation platform. We're really excited about it. It launched over the summer. And some things that are really difference makers compared to our previous platform for sure is number one, HRAS integration. So as you think about clients, the larger they are, the harder it's to administer things like roster and payroll deductions manually. We don't want any of your clients to have to hire people to manage their ICHRA administration on our platform. So integration with HRAS systems is something that is really important to make things more simple. So that's both on roster management side, adds, deletes, as well as payroll deductions on the backside for if someone purchases a plan that's more than their allowance. There's some really intuitive and easy shopping experiences for the employees. Now, one thing I will just say is, we call ourselves a SaaS company. Our platform is really important, but there's a lot of people that are behind the scenes, and there are a lot of people that are in front of our employees face-to-face helping them shop. So Within the platform, we have a lot of decision support tools that are helping employees to choose their plans. I don't know about you all, but when I first signed in to pick my individual plan, because I moved to TakeCommand's ICHRA when I started here, you got to drink the Kool-Aid, right? There was 133 plans in Collin County, Texas for me to choose from. That's overwhelming. I went from having 2 choices at my previous employer to 133. So there has to be ways that we can help someone narrow down their choices. And so our platform will help float a few choices to the top based on who do you want to be your PCP? Are there medications you need to pay attention to? What about hospital systems? If your child's injured, where does your car point itself? Let's make sure that hospital's in network. So we'll float a few choices to the top based on the employee's preferences. But we do firmly believe that we are required to show all ACA compliant plans. So underneath those top recommendations, they'll be able to see everything that's available to them, whether it be on or off exchange, and they can choose something different. If they're still very confused and need additional help, we have a very large team of enrollment specialists that are all licensed and work for TakeCommand, non-commissioned, that help people go through plans and get more personalized recommendations that they can schedule one-on-one time with. And then admin support and platform ability. We have a lot more details and transparency within our platform that admins can really understand how and why their money is moving, what kind of plans employees are choosing, how many employees still need to shop. Really easy to send a mass email to people who are still sitting in the shopping section, et cetera. So a lot of really great things to help with the administration of ICHRA for both the admins as well as the employees. When I say we help our clients with everything related to ICHRA, this is the everything. So we're going to help. I know Deb said URL has resources for this too, but on the ICHRA design, it's really important to get the design right from the beginning, right? What are the classes we're going to set up? How much should we offer? This is our budget. Is it an affordable offer to our employees? So we really focus a lot of time to make sure it's set up correctly from the beginning. We know that moving to ICHRA is new for almost everybody we're talking to. So education is really, really important in steps 2 and 3. And it's education for both the employer and the employee. What we don't want to happen is that the employer doesn't spend enough time with us learning about what ICHRA is, some of the issues that might come up, how to administer it, and they go through implementation and they're disappointed with the process. If we can spend time up front setting those proper expectations, our implementation and after is much, much smoother. We talked about shopping. On the backside, how are we continuing to help our clients with the ongoing support? So number 1 is the payment functionality and then that reporting. So how to see the movement of the payment within the platform. We have a team of client success managers that will work with our clients on a day-to-day basis, plus their broker partners. We also have a broker team. We can share the phone number later. Employee advocacy, we talked about helping solve some of those real-time issues. I'm at the pharmacy and this drug is supposed to be covered and it's not covered, those kind of things. And then compliance. ICHRA technically is a self-funded plan per the regulations. So there are still some compliance things that we need to pay attention to. Help building reports for 1094s, 1095s, reminders for PCORI fees. All of those really good things we still do need to pay attention to. And while TakeCommand does not report to IRS on behalf of our clients, we provide everything that they need so that they and their tax professionals can submit all the appropriate things for them, their own company. All right, so that was all of the things that we do. So what do we help with? Number 1 is identifying, is this client even a good fit? These are just some of the things that we see for why clients are coming to us most frequently. Number 1 by far, high renewal. I got another 23% renewal on my fully insured plan this year. I got another 35%. Well, it's only 16% this year. Maybe we just eat it and hope for better next year. These are why clients are coming to us, is they just cannot sustain the cost increases year over year over year over year. CFOs love ICHRA because they can now set aside a bucket of dollars and know that those bucket of dollars are going to be used for benefits, and it's not going to have those huge increases year over year. Just to call out a couple other things, multi-state footprint is very common these days when we're talking to prospective clients. You can get much more granular when you're setting up your classes on a multi-state footprint kind of a client. It also allows for some flexibility if you have clients that say have a large corporate office in one state and then remote employees kind of scattered. There are the abilities to retain a group health plan for some classes and then offer ICHRA to others. And that, again, is where our sales team can really help you narrow down what is the program going to look like. And then the last one that I'll just point out is growth by acquisition. We work with quite a few clients that roll up to private equity firms. Reason being they're growing quick, or even if just the company is growing quickly organically. I worked for UHC for many years, and you always talked about, oh, no, we have to go harmonize these plans because this company acquired this one and they had UHC and they have Aetna, and these people are going to be mad because UHC is going to absorb it. You don't have to do all the harmonization when you're just buying. When the original company has an ICHRA set up, it's a QLE when the new company comes in, and they just move into the same program that the original entity already had. So it makes it much more simple to bring other entities into the fold when you're working with an ICHRA. Within TakeCommand's book of business, this is what we see more often than not. We work with clients from 1 participating to 5,000 participating. Some of our clients are brand new to being an ALE, so now they have to offer insurance, and it's a tiptoe into the insurance world. A lot of our clients are coming from group health plans, and they're just frustrated and want out. And so they would prefer just to say, here's some money in a tax advantage way, go get your own plan. They're coming to us for the reasons that we mentioned earlier. What about industry? What type of industries use ICHRA more often than not? We have clients in all industries, so this is not an exclusive list, but there are certain industries that see really great success with ICHRA. Healthcare services is one of them. Think home health, long-term living facilities, injection sites, stuff like that, that might typically have either participation problems or stereotypically have a higher cost claim type of population that they employ. Those types of industries are really coming to ICHRA with a higher frequency than others. We have a lot of clients in hospitality, retail, restaurants, manufacturing, and then nonprofits is one that we see a lot of. I think the theme with nonprofits is companies that have a really tight budget. Here, I think nonprofits, whether it be a charity organization or even like church entities, if you get a 25% renewal on your group health plan, and then you have to go ask your congregation to tithe 25% more next year to pay for your employees' health benefits, it's hard to continue to raise more and more and more money year over year. And that's just not exclusive to nonprofits. There are other companies that are just very budget constrained, that having tighter control of your year over year cost is really important. So that's just some of what we see with our book of business. So why do we, quote, lose business? This is kind of a silly slide, but I think it's important just to understand when a client doesn't move forward with ICHRA, why was it? The green things on this chart are things that we have control over. The red is we don't have control over. So a lot of the we have control over is they came to us too late and we didn't have enough time to educate on what ICHRA is and what an implementation of ICHRA looks like. And so they're not quite ready to make that change, because again, it is change. A lot of these entities come back to us again the next year. They already have that foundational information about ICHRA and they're more comfortable moving forward. This to me just shows more time is better. So even if you have clients that you're renewing on their group for 1/1, but it might still be a fit, go ahead and start planting those seeds now so that when you get that high renewal in September or October of next year, it's not the first time they've ever heard about ICHRA. So that really is why we're not why we are not winning, why groups are not moving forward with ICHRA mostly is because of that change management piece and they're just not ready. Some of the other things just to be aware of, especially if you have groups that are smaller than 50, the non-ALEs, is the idea of subsidies and tax credits. This is definitely something that we help our smaller clients think about and pay attention to, because what we don't want to happen is an employer thinking, I'm doing something really good for my employees by giving them an allowance, but then it actually burdens the employee because then they're ineligible for a tax subsidy. For ALEs, it's a different story. We have to offer benefits, but for those that are less than 50, let's just talk about it, what their workforce is like and where it might be a benefit versus a burden. Some geographies, this is not true very often anymore, but there may not be really good options for an individual plan in some geography. This is part of the analysis that our sales team is going to help with. So say you have a pool of employees in Timbuktu and there's only one carrier option and it doesn't have the main hospital and network that everybody uses. That's not going to be a good fit for ICHRA, but we'll help you think through that and look at it. But it is a reason why some employers decide not to make the switch because of their local market. All right, so we developed this slide because really what we have seen over and over again is we don't want to catch people unaware. Now, I also don't want to discourage people from moving to an ICHRA. So for the sake of selling against myself, I'm going to go ahead and share this slide anyways, because we feel like setting proper expectations up front is the best way to set up your clients for success. So these are some things that we want to make sure your clients are aware of. I have a slide deck that actually has multiple points under each of these four that we can go through if this is something that you want to look through in more depth. But at the high level, number one, ICHRA is different from the individual market, and it's also different from the group health plan market. So you have group over here and you have individual over here, and ICHRA is this weird kind of mid thing. We want to make sure that employers understand that it's going to change the way that both the HR admin interacts with the benefits of their employees, as well as how the employee interacts. The whole reason why our name is Take Command is because we want to empower employees to take command of their healthcare. This is really scary for some employers. They don't feel like their employees can do it, but they can. We see a lot of employee satisfaction with their individual plans, and we want to help arm everybody for the best success in knowing that there is going to be more responsibilities on your employees when you move to ICHRA. Number two, this is not a flip switch. Many of you might be used to in the group health plan space calling up your carrier and being like, oh, just retro this to 1/1, or, oh, we missed that deadline, but go ahead and turn us on anyways. The individual market is different. Carriers are different. How applications are submitted are different. And this is just something to know because it also changes how employees, you as the benefits consultant and broker, and the HR are interacting with both Take Command and the carriers. And again, the employee really is taking on more ownership of their insurance. It's going to take some time and patience to set up through implementation. So we're going to help lead you through how to set up our payment functionality. How are we going to set up the HRAS integrations? But there are definitely roles and responsibilities for each partner in the mix. And we just ask for patience. We'll help lead through it, but we will collaborate and get it right. And then lastly, what does offering end-to-end support in ICHRA administration mean? We'll do that and help you through it, but please, please, please rely on us as the experts for ICHRA. Ask us questions when you have it, with or without your clients. It doesn't matter. We want to make sure that everyone knows the things that are really important to know, and make sure that we are providing the right support to all of our partners in the mix. I'm going to move through these fairly quick, but just know there are some really important things that we want to understand about your clients when we're helping set up the design of the ICHRA program. I will just make a plea that think about getting a design or an analysis as an iterative process versus saying, hey, take command, give me a quote. A quote is transactional, right? I have this many employees, this is how much it costs. ICHRA is very different because there's going to be different levers that we pull based on your client's needs. How much do they want to spend? How are we going to set up classes? Are we going to vary allowance by age? We recommend to. Is this an affordable offer? Is it a compliant? Are we going to set up dependent allowances? Are we going to allow employees to also utilize their allowance for qualified medical expenses? Or is this going to be premium only? So there's lots of questions that we're going to ask and go through to build the perfect design. And we typically recommend that you are getting on the phone with our sales team member that did the design for you before bringing the client in, just so you understand how it was initially built, see if there's any tweaks that we should make before then presenting it to your client. The other side of the story is, what can employees purchase? We talked about there are very few geographies where the plan choices aren't all that great. So we want to look at that. We want to look at what the employee contribution is today on a group health plan, maybe try to mimic it or even save them money on the other side. What type of provider networks are in different places? So these are all questions that we're going to be going through. This is just a quick view of how we think about the allowable classes. Our most utilized class is geography, where there is no minimum class size for geography, but others that we use fairly frequently are full-time classes, part-time classes, salary, hourly, and then I mentioned location. There are definitely several others that are options that can help kind of get really granular to make the best plan and the most cost savings as possible, that will help kind of think through when you go through the design process. Real quickly on how the payment function works. So your client has the choice whether to keep it a traditional HRA reimbursement arrangement, that is in the name of ICHRA, health reimbursement arrangement, or use our auto-pay functionality. Auto-pay, we do have a minimum size, so just be aware of that. But most of our clients are eligible for it. The traditional model is employee pays for the premium, validates the coverage, employer reimburses to the employee up to their allowance. So we do have quite a few clients that still utilize a traditional reimbursement arrangement. And this is what we use if you have a client that wants to also cover qualified medical expenses. Auto-pay probably for most of our clients is going to be a better option because you're not asking an employee to upfront the cost of their insurance premium, which is several $100s. In auto-pay, it is much more mimicking what we're used to on the group health plan side. So employer is funding a holding account. What they're funding is the premiums in their entirety Then TakeCommand is facilitating the payment from the employer's holding account to each of the carriers of the individual plans that the employees have chosen. Then on the back side, providing all the reports and or HRIS integrations so that there are payroll deductions for any amount of the premium that exceeds the allowance, and then doing a payroll deduction just like they're used to on the group health plan side. So that just shares a little bit about how the movement of the dollars work. I just threw this in here real quick. There's a lot of ICHRA vendors out there in the space. These are just some ideas of questions to ask and understand about each individual vendor when you're trying to choose who to use. Some additional things that I'll just throw in to here is, how does the vendor handle broker and consultant compensation? How do they handle enrollment? Is it in-house or farmed out? Do they manage a call center, or are they internal employees? Again, this is a huge list of things to understand, but especially because the group I know that we have in front of us, I really want you to understand how you're receiving compensation, because our number one goal is that you are a valued partner of both your clients and us, and we want to keep you in the mix. And it's really important that we take care of our partners when and how and best that we can. So this is just a quick view of how we think about consultant and broker compensation. TakeCommand receives revenue in two ways, and we pay out to our consultant partners in those same two ways, plus number three, which we'll get to. So we receive revenue through our service fees to our clients, as well as we receive carrier commission for those carriers that we are appointed to. And then we share out in both of those ways as well. So there's two different pricing packages that our clients can choose from when they come with a broker that already has compensation built into it. So it's either partner or professional package. The biggest difference between those two is the type of service that they are receiving from TakeCommand on the backside. If you have an ALE 50 or more, they already slot into the professional package. And then we'll split out either 9 or 14 to share back. Then we add to that a percentage of the carrier commissions that we receive. This is a moving target, as you can imagine, for every state and every carrier. So we go through our list of all the carriers we're appointed with and decide how much we're going to share out based on how much we receive, how much volume we're expecting, et cetera, et cetera, et cetera. So in Pennsylvania, as an example, the share of the carrier commission that we give back is $12 PEPM. It ranges everywhere from 0 in states like New York, but really it's 8 to 14 on average PEPM that we share back. So you're going to be starting typically at $26 PEPM that comes back to our consulting partners. But we also want to make sure that you are made whole. So this is the step number 3. If you need more than that, we will bump up the service fee and then charge the additional to your clients. So if you said, hey, Charlotte, 26 is great, but I really need 30, that's a $4 difference that we'll put onto the service fee. So $44 per employee per month, per participating employee per month, by the way, so that then you could get your 30 out of the thing. This is a link to our full compensation guide. It's on our website. We're very open about how we operate with compensation, but just wanted to make sure this audience knew that we build in broker compensation because you are such an integral part to the decision-making process, and we want you to be part of the process going forward that we share back with you. Okay, lastly, who do I call for what and when? This is my contact information and email. I'm really good at getting people to the right place. But if you have firm level questions, if you want an office-wide training on ICHRA, I am the person that you're going to come to each and every day for that. If you have client-specific questions or you think it might be a good fit, but you have more questions, I have a spelling error on this. That's embarrassing. Submit a design request. I will help get you to the right place. We have 5 senior account executives that manage a region across the country, and then several sales team members underneath them, really dividing up by size of the client. So I can help get you to the right place when it comes time for client-specific questions. Okay, with that, I am done blabbing at you for a while. I will see if there's any questions.
There are, and thank you, Charlotte. That was a great presentation, very informative, and I appreciate that, as I'm sure our agent partners do as well. Sharon has a question. If an agent, it's kind of a 2-part. If an agent refers a client to TakeCommand, is there a portal for us to keep track or of the referred employers and employees, or do we need to keep track of that on our own? And since you retain the AOR, do our clients now become your clients, or do we still need to service them in some way? So you kind of answered some of that, but do you want to just reiterate a little bit?
Yeah, it's a great question. So at this point in time, what a lot of our broker partners do is they have their clients add them as an admin into the portal. Future state roadmap is that we will have a broker portal. It's just not ready yet. So there are ways to see all the same things that your admins do, but they have to add you as a user in their portal. To answer the question about, really the gist of the question is, should we remain involved or not? The answer is yes, you should remain involved unless you don't want to. We have a wide variety of interactions with our broker and consultant partners. The way that I think about the arrangement is we might be the agent of record on all of the individual plans, but in most cases, we want you to remain the broker of record on the client itself. And so that looks like strategy and renewal seasons and advising about, that crazy ICHRA vendor TakeCommand is doing this. What should we do? I always say that clients need a third-party entity really on the advising side, and we would like for you to be that broker in the mix. But if you want to say, here's a client, don't put me on any emails, I'll just accept my commission, that is your choice.
Yeah, and I think those are great questions. Those are really typical questions. And, at the end of the day, you are the commodity as that relationship with the group. So you are, bringing them to a solution. You're involved in many, many ways, but you don't have to be, to Charlotte's point, don't have to be involved in the nitty gritty, just knowing that you brought the solution in and you are providing that service as you always have to your client, or as you will to your new prospects. I just wanted to touch base real quick for all of those that you have joined our webinar series. Thank you so much. I really appreciate it. Yeah. I just found out that the Capital Blue Cross that we had 2 weeks ago did not record, but there is news. I know, I apologize. That was a technical issue, all my fault. But they are having an individual ICHRA training on October 14th from 12:30 to 2. So I would encourage you to join in. I thought it was important when we were looking at our ICHRA partners to also include our local carriers, because they've come a long way in really supporting these ICHRA solutions and the holistic approach, the approach to the consumer experience, to make sure that at the end of the day, those consumers are not having left with a bad taste in their mouth from the employer. From the carrier side. And they've come a long way. So I apologize to our partner Capital for not getting that recorded. But again, if you want to take advantage on October 15th, also URL, we have, again, that whole team. So reach out. We can help you with just the conversation and some talking points as well. And, we'll let you know if the best approach is QSERA, ICHRA, or just retaining a robust dental, vision, group plan and voluntary benefits, and maybe dissolving group health coverage for those smaller groups. But again, keep watching. As we mentioned before, we have really exciting news that we're going to be sharing here in the next couple of weeks on the ICHRA front. But for Charlotte, I really appreciate you joining in and talking about Take Command Health and what they really bring to the market in this space. And for you, I wish your family a very happy trip up to the Hudson River Valley. And everyone have a great long Columbus Day weekend. And thank you again. Bye-bye.
Thank you. Bye.